Hi everybody, it is Dr. Liz from Helendale Dermatology and Helendale Hair Center. And today I want to talk a little bit about hair loss. September is National Hair Loss Month. We deal with hair loss on a daily basis, both men and women. We do everything from topical agents, we have Revitalash, we have a prescription strength Rogaine, or minoxidil, along with topical Propecia. We do not prescribe oral minoxidil in this practice. Twofold reasons. One, it's a blood pressure pill, and it's actually a pretty good blood pressure pill, so we're not in the business of really sort of monitoring your blood pressure. And two, oral minoxidil, the TikTok videos don't explain this, but it will cause you to grow hair everywhere. So most of us are not willing to go and increase hair up here at the price of increasing facial hair, arm hair, back hair, everything else like that. For guys, obviously, it's not as big of an issue as women, but even men don't typically like that excessive hair growth everywhere. And that's really how Rogaine was started, is that people that would be treating their blood pressure with oral minoxidil, they grew hairy all over. So some dermatologists said, hey, let me take the pills, crush them up in some alcohol, and we will go and put them on top of the scalp. So that being said, we don't really know exactly how topicals work, whether it's Revitalash, whether it's other serums out there, whether it's the minoxidil itself. We know that what it's going to do is it's going to prolong the growth cycle of hair. So why do we lose our hair typically? Short of medical reasons, thyroid, stuff like that, the majority of age-related hair loss, and it happens in both men and women, happens because our follicles actually just get tired, to be honest, all right? And what we do is we have a growth phase, a resting phase, and then a falling out phase. And our hair goes through those cycles probably about 25 times in a given lifespan. But as we age, that cycle increases. So it produces a shorter, finer hair. And a lot of us, we can look at those wispy, sort of along our hairline, that quote unquote fuzz, all right? And that's the miniaturization of our hair follicles due to age. We don't ask hereditary issues anymore because the hereditary, we don't understand the genetics of hair loss. We know it's probably gonna affect most women. We talk about 80-85% of men or women are gonna get some sort of hair loss. In men, typically it will start in the back or start in the front and kind of converge into this whole area. We talk about a loss of a hairline in men. So men will not retain their hair, their hair line. They will sort of lose that hairline and then sort of everything behind it. Now women will lose their hair in this whole area here, but typically we retain our frontal hairline very nicely, and it usually will sort of start here and progress to this whole area up here. Typically, women will never get completely bald where men will. So, it's really that aging the hair follicle, the way that hair follicle will speed up that process. So the growing phase is very short. A lot of women, there was a woman in earlier that said that her hair used to be down to her waist. Now she can't grow up beyond really sort of her shoulders. And that's because she's 75 and that hair follicle is growing faster. It's growing, it's resting, it's falling out in a faster cycle, and it just will not produce that great of a hair. So everything topically, what we're trying to do is we're trying to slow down that growth cycle so that it grows slower, it rests slower or for longer periods of time, and then you get that falling out. So it's instead of maybe 1 or 2 years, we try to stretch it back out to 4 or 5 years. So we will lose about 100 to 150 hairs a day. That's completely normal, okay? More than that, we get a little concerned. We do know that, male and female pattern hair loss, it's age related. Sometimes we'll go in cycles that, people get a lot of shedding and then they won't get shedding. We do know that if we do nothing, it will progress and it will get worse. So, and I always tell patients they're sitting on a gold mine in terms of what hair they have. So we always do want to keep what you have and keep that there and try to minimize that more growth, okay? So what topicals will do is a lot of times they take these wispy peach fuzzy things and they'll make them longer and thicker, and that's our hope. That's what we're trying to do. is go and turn back the clock a little bit, plus keep what you have. Other things that we can do, platelet-rich plasma. I brought PRP into Rochester, and we're proud that I think we do it more awesomely than everybody else, okay? And what that is it stands for platelet-rich plasma. We take your blood, we take 60 cc's of your blood, which is a fair amount, okay? So we always like, the nurses really like it when you drink your water before you come in. We draw that blood off, we do what we call a double spin, and what we're trying to do is get as many platelets as we can, because we know platelets, they're our clotting part of our blood. We know when they're activated, they release growth factors, not growth hormone. Growth hormone's the one that makes you look all buffed and your head's gonna pop off and stuff like that. Growth factors are what keep our cells thinking that they're young. So we take these platelets, these activated platelets and all those growth factors, all right? We inject them into the scalp, all right? And then we rub a little bit onto the scalp afterwards. We know that that's gonna also help turn back the clock, that it's really gonna take those cells that have those follicles that have quote unquote miniaturized by getting older. They produce a shorter hair, a finer hair, even a lighter hair in color often, okay? And it's gonna make them a better hair follicle and therefore produce a better, bulkier hair that is thicker, okay? That is more luxurious, it's longer. It maybe holds your regular texture, all right, better. So that's what we're trying to achieve always. The PRP has been great for the practice in terms of our patients, that they have really had great successes with it. We've had some great anecdotal patients who, had bad COVID, things like that, got the COVID vaccine, whatever, but their body, their hair just like revolted. And I always say that our hair is ornamental. It really doesn't serve any medical purpose for our body, so that when our health suffers, our hair will suffer also. So people that really just had long COVID, they reacted to the vaccines, whatever, that their hair just went really sort of down the toilet afterwards, and PRP has really brought their hair back, and it's been so nice to see, so gratifying, especially for those patients. So we have that, we have the platelet-rich plasma, we have something called neolights, which are low-level lights. We know that years ago, it was described in the literature, I think 2003, by Walter Unger. He was one of the leaders in hair transplant in Canada. We don't know, same thing, we don't understand how it works, but somehow it activates those hair follicles to be better, bulkier, to produce a better hair. I always tell patients this, nothing grows hair. So if a vitamin, something else like that says it grows hair, they're lying. Once the hair follicle is gone, it's gone. And there's really nothing short of a transplant that we can do. So we always do really try to keep your hair and try to give you all the tools possible to keep what you have and to prevent further hair loss. So, we definitely use PRP with that. We use the topicals, and it's just, they're all great things. And often people won't do just one, they do multiples. They'll do PRP and maybe Revitalash. They'll do PRP and maybe the topical minoxidil with the Propecia. So, a lot of times we do try to pull out the stops because we know that it's a process that's only going to continue. So we're going to try to halt that process. So I guess takeaway lessons: 1, nothing grows hair. 2, we do it all here, from hair transplants to PRP. Like I said, we brought PRP into town, this office, so I feel like we have the most experience with it. We've experienced different, systems and all this other stuff. We still love our big, blood draws along with that double spin for hair loss patients. And, we have topicals. So lots of different things. If you have any questions, you come in, you see me. A lot of the hair loss patients see Amy daily. She's one of the physician assistants. She's off this week. That's why she's not doing this video, but she's off, and she is really sort of our hair loss coordinator. She does all the PRPs. She's been doing this, she's delved into the literature, you know, she delves into it every month just to see if there's anything new or this or that. So she's really an expert also. And make an appointment with one of us and get in, and you know, if you have questions, if we think it's medical based, we will do, you know, thyroid tests, things like that. But most of us, sadly, is just good old aging of that hair follicle, and that our body senses a decline in probably those growth factors, amongst other things, and really speeds up that sort of growth cycle so that we're producing not as good a hair. So if you have any questions, give us a call, give us a question, and thank you so much again. Thank you. I always appreciate your guys' support for Helendale. I appreciate you watching this video, and I'd say come see me and Amy if you have any questions. All right, everybody, thank you so much, and have a great rest of the summer.